So really the first thing when you're addressing colon cancer screening is to talk about the different options that you have. The overall importance is to do one of the things that are offered. They range from stool tests that can be a couple of samples that you do at home and send into your doctor, to a colonoscopy, which is probably the more well-known, more popular option. The stool tests have different ups and downs. Those are repeated more often than a colonoscopy. Screening for colon cancer in general is important. It's a very common cause of cancer. I believe it's second most common cause in females and third in males. It's one of the leading causes of cancer death. So it is actually important to know about. Then most importantly for screening options, it's very treatable when it's found early. When it's caught early, which is the overall goal of any of these things, especially with colonoscopy or even the stool test. When it's caught early, the prognosis is very good, whether it requires surgery or not, or whether it can all be resected at the time of colonoscopy. The mainstay and the main focus of screening and colonoscopy in general is to look for what we call adenomas. There are two basic types of polyps, and if we find those adenomas, those are the ones that you hear patients talk about, your family talk about, well, they found polyps and I have to come back in 3 years or 5 years. We have different recommendations based on the number and the size and how they were removed. All insurances are different, as every doctor and patient knows. In general, your screening exam, if you're doing it for colon cancer screening, should be covered for the most part. Absolutely, there are nuances to each one, but for the most part it should be covered. I would say that almost everyone needs one of the options. The actual choice between a stool test that is done at home yearly or every 3 or 4 years versus a colonoscopy, which can be done up to every 5 or 10 years, that really needs to be something you discuss with your primary care doctor. They can go through the ins and outs of that. I would say the main benefit between the stool test versus a colonoscopy, the stool test really aim at detecting lesions that are already there. They do examine whether it's blood or DNA in your stool and look for more what we call advanced lesions versus colonoscopy, which we advertise and say as one of the most preventable forms of screening. It can actually find very small lesions before they ever develop into anything. So ideally, you're removing the worrisome lesion or spot before it ever develops into anything else. Colonoscopy, by definition, is a small, flexible tube that is inserted in your bottom. We can visually examine your entire colon, looking for lesions, polyps, tumors, anything else that we can find. It is done under sedation, which is always a concern of some patients, and most of the time when patients wake up, they say, have we even started yet? It wasn't near as bad as I thought. In the last 15, 20 years, it's definitely become more of a mainstream option. It's definitely the most popular option for screening for colon cancer in general. So in general, 50 is the main starting point. That's what we call our average risk patient is at 50 years old. Your primary care doctor will start talking to you about that, and if they haven't, bring that up if you're age 50 or above on what option's best for you. Other things that can influence your initial screening age include a family history of colon polyps, family history of colon cancer, a history of inflammatory bowel disease, or other kind of chronic medical conditions. It should all be addressed, but in general it's 50 years old. If someone has had colon cancer in your family, it is worth noting that in general you start 10 years before they were diagnosed. So for a colonoscopy, the most apprehensive part is definitely the prep. Like I said, most patients will agree when it's all said and done that the hardest or most intensive part was the part they had to do in the privacy of their own home, which is actually a perk. The prep has evolved. It's ranged from drinking a gallon of liquid, which years ago, and now there's options where it's a very small volume down to, I believe it's somewhere between 30, 48 ounces of actual medicine combined with a lot of water. We have all this written out easy explanations. We've answered almost any question you can think of has been asked and answered. But in general, it is a prep the night before. So your diet changes the day before the procedure. The prep is usually started in the afternoon and sometimes at night the day before. The day of the procedure, you show up. Anesthesia is provided. We have our own anesthesia service that just covers. They do it all day long, colonoscopy, so they're very adept at keeping you comfortable. And then the procedure itself takes anywhere from 20, 30 minutes, sometimes an hour, depending on what we find.